So, like I said, today I wanted to run over because it kind of comes up pretty commonly recently with, the way I've changed how I do the final and everything. I wanted to break down the MBLEX categories and just kind of like the information that's kind of contained within them, and just go over some general topics and key points to really focus on and look at, and maybe even mention where you can find them in the program and in your own books as well. So some of these things are pretty straightforward, pretty easy, and I do already have pre-recorded material for them. So let's just go ahead and knock out a couple of the easy categories. Now, hopefully you guys can see well enough the thing I'm sharing here, which is the actual breakdown that the MBLEX gives you. So you can actually go to the FSM2B website and you can download this and get updated for any changes of material and what they like to cover. But this is essentially what they tell you is going to be the breakdown of your test, and that, essentially on the MBLEX, 11% of your test should be from the category of anatomy, physiology, and then so on and so forth of them all. And again, so this is kind of how I have redone and curtailed and made my new finals, so that I've pooled questions together into these categories, and you're going to have specific questions from each of those categories throughout your test, and you'll get a breakdown very similar to how the MBLEX does it, because with the MBLEX, they grade you essentially on each category individually, and they essentially want you to pass at least with about 70% in each category. So like I said, let's just go ahead and knock out some of the easy ones and just mention a few things that might help you study the stuff. So first off, anatomy and physiology. It's pretty straightforward, right? I mean, nothing too kind of hidden. There's not a whole lot to unpack out of this category. Your essential things are, as it lists here, both the structures and the functions of the system. And that's the basics of what you need to gather from every physiological system regardless, right? The first thing you want to do when you start learning a new system is to learn, like, what is this system responsible for? Why do we have it in our body? What does it do for our body? Then you want to learn where the structures are. So for instance, like the digestive system, where are all the different organs in the digestive system? Where's the liver? Where's the small intestines? What are the parts of the large intestines, and so on and so forth, which, and also have a good idea of what those structures do. For instance, like the stomach, the J-shaped organ that will grind up and digest both mechanically and chemically food, and then passes it into the small intestines, and the small intestines is responsible for further dissolving the food and pulling out the nutrients from it. Roughly about 90% of the absorption of the nutrients that we intake occurs within the small intestines itself, right? So, and it's, like I said, it doesn't have to be like super detailed, but just have a general basic understanding of what these systems do and what the structures within those systems do, and essentially where they are. In this category, I think a big concept there too is tissue injury and repair. Now, of course, I'm pretty sure in this generic category, it's probably more along the lines of, what are the processes of tissue repair, which is, there's two types of ways that tissues can heal and repair, which is remodeling or regenerating, right? What is the difference, right? Remodeling is sort of remaking what you can out of what you have, sort of like if I, broke down my house and used different pieces to slap it back together, right? I remodeled. Regenerating is that you replace tissue with new tissue. Typically, the easiest example of that is scar tissue, which, like I said, that's the basics of how it is. But one topic that I will talk about a lot too is how all of these categories interrelate to one another, and how you need to be able to pull from each and every category there is out there to bring all this information together and use that in an abstract way to problem solve, because that's a lot of what you're going to see both on my tests and the MBLEX, because they want you to be comprehensive. We want to be able to see that you have gathered a certain level of knowledge and that you can apply this in a clinical sense, clinical reasoning, as as we like to call it. So also there is the concepts of energetic anatomy. Yes, it's not a huge focus, but there is a small portion of the Eastern modalities, Eastern medicine that you will encounter on the MBLEX. Some of the bigger topics from that category I could say would be knowing the chakra system, knowing what meridians are, knowing the various Eastern modality techniques like shiatsu, Thai massage, have a general understanding of, some traditional Chinese medicine. Usually like just the generic stuff in the book can kind of get you by, but probably a topic that I would pay less attention to overall. But, just a few things I'd say that are probably overall best to really gather out of there. Chakras, meridians, shiatsu points, things like that. So kinesiology is, well, pretty straightforward. It's the joints, it's the muscles, it's and then the types of movements that they do. So of course I do have a video already encompassing all this. I think several to be in fact, and then of course I'm doing all of the videos progressively of each and every section of the body, both its muscular structure, skeletal structure, and the joints and the movements and how it all works together. But there is a few concepts that we do want to pay attention to out of this category, such as the proprioceptors. Now the proprioceptors, and this is our first example of how interrelated these categories are and how one category could technically still have parts of another category, because proprioceptors are actually stuff that you'd find in the nervous system, or we might even find in the muscular system from the previous topic, the previous category. So proprioceptors, just to keep it sweet and to the point, the two main ones we find in the muscular structures are the muscle spindle fibers and the Golgi tendon organs. The muscle spindle fibers are what are responsible for measuring the length and how rapidly that length of the muscle is changing. And then the Golgi tendon organ is responsible for measuring the amount of tensile force that is being placed on the muscle, typically at the musculotendinous junction. So having a good understanding of that can really help you with some of the other concepts that we'll take a look at throughout the entire program. So like I said, you can already see a little bit of interrelatedness there as well. So now it does say origins and insertions and actions under the muscle locations and attachments and everything. And yes, it's good to have an idea, but if you watch my video, you'll see how I typically try to teach and would prefer that the kinesiology is learned. Just because, typically when people, look at the traditional way of learning kinesiology, which is making a big long spreadsheet of origins and assertions and actions, it's a huge disconnect from the reality of what kinesiology is, which is movement, and to literally be able to do the movements that you're learning and like feel and witness real time what muscles are being engaged, what joints are going through certain ranges of motion, and so on and so forth. Which goes into the last two parts of this category in itself, joint structure and function. Again, you can find that most likely within the skeletal system, as the skeletal system does cover joints and the basics of their functions. I do talk about a major cheat sheet, which is that if you know the labeling of a joint and what that joint can do and how it can function, then all you need to know is what type of joint am I looking at. So for instance, the glenohumeral joint. The glenohumeral joint is a ball and socket joint, but if you already know that a ball and socket joint is structured like this, like so, and can only perform XYZ movements, then if I just tell you that this joint is a ball and socket joint, no matter what the name is, then you should already know what it does, even having never technically looked at that specific joint. Now, of course, there's some specificities to all the joints that you might want to brush over, but understanding what I call the core concept behind that is very important. Range of motion is the other topic within this category, which, very big, and it's oftentimes pretty confusing to individuals, understanding the different types of range of motion. So as it shows here, it's listed active, passive, and resisted. So of course, active range of motion is where my client is actively engaging and contracting muscles to perform the movements of the joints. Passive range of motion is if I'm taking my client's body part, such as their arm or leg, and I'm moving the joints without them interfering or putting any input in on their own accord. So they could be asleep on the table and I'm moving the joints passively. Now, resisted is where it gets a little confusing because, and I would even suggest that there's another topic they missed there, which is assisted exercises as well. But resisted and assisted exercises change the dynamic of the movements, right? And that's where we get into some deeper concepts that you'll find in a later topic, such as the client assessment, where we find like PNF stretching or proprioceptive neuromuscular facilitation, often also referred to as muscle energy techniques, where we can have a muscle contract, and we can either resist that contraction or we can assist the movement of that action as well. And so this is where we get into the different types of muscular contractions, where we have isotonic versus isometric. And to keep it simple, isotonic is where a muscle is changing length, and then we'll get to the parts of that in just a second. And then isometric means that the muscle is not changing length. In both of these instances, the muscle is contracted or engaged or activated or stimulated, but like I said, isotonic, it's moving or changing lengths. Isometric, it's not. So isometric would be if I was just holding an apple in my hand like this. There's isometric contractions throughout the chain of muscles involved to hold an apple in this particular position. Now, if I move the apple up and down, now there's isometric contractions happening in various muscles, again, in that chain. So the isotonic is probably a little bit more confusing and involved because there's technically three, if you look at sports science, phases of an isotonic movement. We have the concentric phase, which is where the muscle is contracting, concentric contraction, or getting shorter. We have the eccentric phase where the muscle is elongating or stretching back out. And then we have technically the amortization phase, which is the brief pause as those two phases change. And, again, in sports science, we call the concentric phase the acceleration phase, and then deceleration phase for the eccentric contraction as well. But like I said, I do have a video for that already. And technically, I have a video for the anatomy and physiology, roughly. Not too detailed for physiology. It's kind of tied into my section on pathology, which is our next topic here based off of the MBLEX's breakdown, which I do go over every single pathology that is in the book. And, sometimes I'll throw in a few others on my own accord that I think are, relative and worthwhile to know. But pathology is another big category here, according to the MBLEX. And it's not just the pathological conditions, but also being able to rule out the contraindications, make sure that we're able to adequately discern if massage is appropriate, safe for a client, right? And then make sure that we're cautious and know where and what we can do in certain areas of the body. For instance, some areas of the body, just don't warrant a lot of pressure as opposed to others, right? So for instance, I'm probably not going to put as much pressure working on someone's abdomen as I could on someone's upper back. So the few topics that we see here in the pathology section, of course, is the overview of pathologies. And I like that explanation, overview. I mean, there is numerous, almost endless pathologies that you could learn, but we don't have to, right? And my general explanation, my general summation for you is to just make sure you have a good working understanding of all the pathologies listed in your book. And there's also other resources and websites that will list specific pathologies relevant to the massage practice that you can also review and take a look at if you so want to go above and beyond and learn a few more. But I assure you, if you adequately understand at least every pathology in the book, which seems like a daunting task, but a lot of them are very simple, and you're going to probably know most or a few off the top of your head regardless, just because if you've been alive, essentially. So this shouldn't be too problematic to go over the ones that probably don't easily give away what they are. Now, I will say a cheat sheet for pathology is make sure you go back to anatomy and physiology chapter where you learn the language of medicine, right? Very important, because a lot of times pathologies, if you break down the name of the pathology into its different parts and those root words and prefixes and suffixes and all that, you'll oftentimes get a really good understanding, if not almost a complete explanation of what this pathology is talking about or responsible for. So that's a little bit multifaceted for sure. And like I said, I do have videos on all the pathologies. There's 4 different videos. Each are about an hour and a half long, but I did timestamp them all, and you can look at the specific physiological chapters and look at what's and I timestamped each pathology as I go over it. Some take about maybe 10-15 minutes to go over, the really more advanced ones, especially ones that massage can really innervate and be beneficial for. And then some are quick, simple, like this is it, this is what it is, and it's like 2 minutes, right? So contraindications is another topic in the pathologies here. Which again, a very big broad category, which goes along with a lot of the pathologies, so that's another thing you should consider as you're learning your pathologies, is start to coordinate into what we would see in the next section, which is the benefits of massage. What does massage do to the body? And based off of what this pathology does to the body, how could the two interact to either be beneficial or be problematic, right? And then again, that's where that problem solving mentality comes into play. So contraindications listed here is obviously site specific, and okay, I was gonna and then so in the topic C, areas of caution. So site specific obviously would be what we would call local contraindications. Most likely contraindications that would just cause us to avoid an area, such as localized inflammation, rashes, cuts, bruises, things of that nature, maybe intense acne or eczema, things like that. Just a couple general things that you would probably want to avoid an area, but you wouldn't have to stop doing massage in total for your client. But also areas of caution, I would say probably is also relatively site specific, because there's some areas of the body that we want to be very careful of working in, namely because there are structures in there that we can cause harm to. So I'll just go ahead and wrap that section up into this, which are areas of caution. What I suggest that you do from this is, one, you want to know what is that area. Essentially, I call it what are the borders of that area. And by borders, it's typically outlined by other anatomical structures. And then there's, obviously things within that little area that we can harm. So some of the examples would be the anterior triangle of the neck, which, is the jawline, the trachea, and the STM, where we have the carotid artery, jugular vein, vagus nerve, we have the lymph nodes, cervical lymph nodes, so on and so forth. We have so anterior triangle means that there's a posterior triangle. So that's the SCM, the clavicle, technically it's the omohyoid, and the trapezius muscle. And then we have parts of the brachial plexus, other blood vessels as well. And in general, what are we going to be cautious of in the body of harming? Blood vessels, veins, arteries, right? Nerves, lymph nodes, organs, right? Stuff like that. So the major sites to really look out for is anterior triangle, posterior triangle, Obviously, the abdomen is technically a cautionary site. The low back, 12th rib area is a cautionary site. You know, sometimes, you know, working around the sacral region, you know, right around the piriformis region, you know, you do want to be cautious, but it is pretty meaty, so it's not the most problematic area. The femoral triangle, also known as the inguinal triangle, is also a big one. That's the groin. The popliteal region, which is the back of the knee, just to name a select few. The antecubital region, also the front of the elbow there. So, and obviously, there it is listed right there. Pathology-related contraindications, special populations. You know, yeah, there is a whole section in your book dedicated to just that topic. You know, special populations would include, you know, any disabilities such as, you know, vision, either impaired or, you know, completely disabled, such as blind, hearing, you know, mental capacities, things of those nature, right? Pregnancy, all those good things, right? And it's kind of relatively self-explanatory. You know, what would you do if you had a client that was blind, right? Like, what is the proper ethical interactions with a client of that nature? How do you walk them through the facility? How do you walk them through the room? How do you explain where things are? Stuff like that, right? Or what if they're deaf? What if they, you know, all of these things and above, right? So pretty much that's all that's really in that category, and is pretty straightforward. And, you know, you can kind of postulate 10 ways to Sunday what to do, but yeah, you can take a look at your chapter 11 in your book, which special populations is listed again as another category, whatever, I guess. Classes of medications. Now, that's a big deep well of topic as also, because there's lots of classes of medications out there. Some of the most pertinent and important ones for massage therapists would be pain relievers like narcotics. Now, you probably don't have to go into depth of knowing which ones are there out there on the market. And if you got the hookup, then let me know. But not knowing necessarily the specifics, right? But knowing what to do based off of the classes of those medications. So narcotics, obviously, if they reduce people's sensitivity and sensation of pain, that's a problem for massage, because they don't know if we're hurting them or causing tissue damage. So if your client is under the influence of a narcotic or a pain reliever or a painkiller, then, you know, it's probably best to either avoid the massage, or probably MBLEX standard would be avoid the massage completely, or just, you know, be very gentle with working on that client. Blood thinners, blood thinning medications, right? Those are usually a big listed one, because, you know, they're more susceptible to bruising. So we do have to be mindful and careful of our pressure. Those are the two biggest ones. But there is the drug reference handbook for massage therapists. You can find that on Amazon or pretty much any bookstore. And it's a pretty nice book, because it goes through the specific classifications, and then it tells you some of the names of common brands and off brands of those medications. And then it tells you, you know, how those medications interact with the body and what our massage techniques might do in regards to those interactions. So the drug reference handbook for massage therapists, very good resource for you to have and keep, you know, with you at all times as a massage therapist. So I'm just going to take a quick Mr. Rogers moment and just take off my sweaters, get a little warm in here with the lights on. Howdy, neighbor. How's your day going? Learning about massage? All right. So our next category is the benefits and the effects of soft tissue manipulation. An extremely important section, because, you know, the general golden rule about massage and learning massage is, what are you doing and why? Think about that for a sec as I hydrate. But yes, all of massage has physiological and mechanical components to it that are going to cause the body to react and change. Most of the time for the better, but sometimes we need to understand how the effects of what we're doing go again to that previous category, pathologies and contraindications, how that can alter these things, right? So of course, first and foremost, what are the physiological effects of manipulating the body with physical hands-on massage? So pretty much a long list, right? And it's a lot longer than the psychological and the mechanical effects. And I do have a video on the benefits and effects of massage. And I even go into and break down the specific massage strokes like petrissage and effleurage and what they do and how they affect the body and some general ideas and contraindications behind them. Needless to say, a short, sweet, to the point thing about physiological effects. If you look at, and you go back to the anatomy and physiology section, the nervous system, specifically in regards to the autonomic nervous system and the breakdown of the sympathetic versus parasympathetic response, those are essentially all the changes that massage could cause in the body. Massage theoretically could elicit a fight or flight response in our clients, right, to cause the sympathetic engagement or reactions. But massage most commonly, and is what we're really trying to do for our clients, which is to activate and engage the parasympathetic response and all the benefits entailed there. So pretty much to find out the answers to topic A there, just look at the nervous system, because in reality, people always think that massage is muscle work, but I don't think so. Massage is nervous system work, right? I mean, nothing's going to change in the human body without the nervous system and the endocrine systems changing and altering and say so. And then again, even then, it's just, nervous system, right? And we affect that nervous system largely through the median of the skin. Now, of course, there are, external perceptions that we can do, such as, like the ASMR stuff, that were obviously going to affect the nervous system and all that. But obviously, our physical manipulations are being registered and picked up and detected by numerous receptors in the nervous system, which are then causing changes. And to basically explain physiological changes, anything that massage is going to do that is going to change and alter how the body is functioning is a physiological change. Rant over. Thank you for my TED Talk. The psychological effects of soft tissue manipulation, a rather short list, and theoretically some of those benefits listed there could be argued into the physiological section, which is decreased depression and anxiety, right? And, there's obviously hormonal components and aspects of that, but we'll typically put those two topics in the psychological category. But reduced anxiety, stress, depression, typically providing our client a better sense of well-being, creating body awareness for our clients through the physical touch means, are just to name a few. Effects for client manipulation on special populations kind of goes along, see how, again, it all interrelates, right? Goes along with the previous category, because obviously when you learn about special populations, you're going to learn about what touch can do for other special populations, especially like ambulatory people, elderly people, people who are victims of trauma, people who have, sort of like ADHD, stuff like that, mental disorders, cognitive disorders, excuse me, I think is the more appropriate term there. Which again, you kind of learn all of that regardless in the previous section. Of course, obviously know all your soft tissue strokes, right? Effleurage, petrissage, know all the variations. And again, what do they do? And essentially, what's the appropriate procedure of creating a good and enjoyable massage routine for your clients. Here we have the effects of hot and cold applications, the use of thermo and cryotherapy. Typically knowing, the general benefits of each and the effects of each is very important. Generally, they're almost interchangeable. They're almost one and the same with just a few slight variations. So your heat is obviously going to relax and soften the tissues, essentially melt them out, and increases the tissue pliability, stuff like that. But, heat's going to decrease pain. It's going to create a sense of relaxation. It's going to create a sense of feel good. Cold is obviously going to make the structures and tissues harder and rigid, right? Which is decreasing tissue pliability and extensibility. But it also will decrease pain. It will also, might not be the most relaxing. I personally don't like the cold, but some people might find it relaxing. So you might find some kind of argument for it. But your section on what chapter is it? Hydrotherapy, excuse me. There it is. Hydrotherapy is going to have all that information, and knowing when to use and not to use each of those, right? Again, goes into the contraindications, pathology section. Typically, if the area is inflamed, we obviously don't want to use heat because heat is an inflammatory agent. And then we'd prefer to use cold because it's anti-inflammatory. Now, I will say this, I'll preface this with a piece of bit of real life information. I know you probably have learned in the course of your life, or maybe even in the program, and if you did learn in the program, let me know so I can execute order 66 on that information. But the old method of dealing with soft tissue injuries was the Price method, which is to protect, rest, ice, compress, and elevate the injured area. Well, there's a never-ending debate about the use of ice on a recent injury or inflammation, simply because, ice is going to, as we said, decrease inflammation. But then again, the whole purpose of the inflammatory process in regards to an injury is to create and promote healing, right? Inflammation is a good thing if it's natural and normal. Now, obviously, excess inflammation is usually a lot of the pathologies that we probably should have learned. But in this particular instance, the general belief is that using ice to reduce inflammation when the inflammation is necessary in regards to an injury or an infection is typically going to retard the process of healing. Now, obviously, if the inflammation is super excessive, it's warranted, and so on and so forth. But there is definitely a differing topic. And so we've moved from the Price method to the MCE method, which is movement, compression, and elevation. Movement within functional limits, because movement is going to essentially help to pump out the lymphatic fluid and just kind of keep pumping the area in essence, basically. Compression obviously is going to help with the swelling as well, and then elevation obviously helping with the swelling as well. And then an overview of the bodywork and massage modalities. This would be found pretty much in chapter 14, where we're going to have, you should have a general idea of like what Rolfing is, some of the major brands of massage, Rolfing, polarity therapy, have an understanding of the deep transverse friction, which, every piece of information I ever look up on that it's just all quackadoo stuff, but the MBLEX still has, deep transverse friction highly labeled out there in questions. So, deep transverse friction, what it is, what it does. We listed that earlier, the PNF stretching, muscle energy technique, sports massage, just the generic general things and applications, hot stone massage, prenatal massage, right? Just to have a good understanding of what those entail roughly, when to use them, why to use them, when not to use them, all those good things. Client assessment. That is obviously the broadest category and the most detailed category, and probably the toughest category that most people might encounter. And as you can see, the most heavily weighted section out of this entire breakdown. So, of course, this involves, as it lists here in category A, the organization of a massage and bodywork session. So, knowing, the structuring routine and, what makes a good routine, as we previously just mentioned. But client consultations and evaluation, what is the process of doing a proper health history intake? What are some of the expectations, and what are some of the necessities of going over someone's paperwork, and what should be on someone's paperwork? What are the things you're looking for? What are the things you're talking about? Where are you finding this relevant information, and how are you using it? Is essentially the go-to. Written data collection, right? Understanding how to document your client's information, which, obviously we have quite a few methods, the most common being the SOAP method, but there's the APR, the SOAPier, the PICO method, all these various ones, which you might want to have a small understanding, but mostly focus on, some of the major ones like the SOAP and SOAPier method, just because it's the most common, but also understand some common and important data collection information, such as never using whiteout, making sure that if you're actually physically writing out your notes, no whiteout, right? Just a single line cross through is what you're going to do. Make sure that you're not using fuchsia pink, right? Blue or black ink. Making sure that it's legible and you're using common abbreviations that are accepted amongst, data, their health history, or excuse me, SOAP notes and documentation and all that. Making sure, another key point too is if you have extra space when you're writing something out, draw a line through the remaining space to indicate where you stop. That way no one can technically come back over your notes and write stuff in that you didn't. Visual assessments. Now that's a pretty broad and big category. So there's lots of assessments we can do, and such as range of motion assessments, right? Which is kind of goes, I guess, back maybe more into the kinesiology and stuff like that. But let's just go ahead and knock them out in order. So first off, a general visual assessment is just, you can just look at your client and see and indicate anything. So this would be like if they were laying on your table, you assess the skin. Is there any broken skin? Is there any rashes? Is there anything you're going to need to avoid? Postural assessments, obviously, are you're looking at someone's posture, and this could be done while they're seated or while they're standing. So we typically call this a static postural assessment. Now, a static postural assessment, just to make it quick, short, and sweet to the point, is typically done either in front of a grid where you can see like lines that you can kind of mark the symmetry of the body, and or using a plumb line, which a plumb line is typically like a string hanging from the ceiling with a weight on it, so it hangs, directly vertical, and you have a client stand behind it, and you can assess again the symmetry. And that's basically the understanding the point of these assessments is really major, right? So a static postural assessment is meant for identifying symmetries or imbalances structurally with your client. So the next thing you want to know about the postural assessments is, one, what it's for and how to do it, but what are you looking for to assess symmetry? Now, there's lots of landmarks, but some of the major ones are like ears, clavicles, the apex of the armpit, the ASIS of the hips, the knees, the ankles, things like that, right? And that's from an anterior view, right? And based off of those findings, what could you assess, right? If one shoulder was higher than the other, or if I leaned here, or if one hip was higher than the other, what do those things indicate, right? Such as other pathologies, maybe scoliosis, maybe leg length discrepancy, maybe whatever, right? So all these different types of things could be indicated. So you want to learn, and this is also in chapter 14, you want to learn, of course, the purpose of the assessment, but how to do the assessment, the landmarks involved in the assessment, and what those findings can indicate, right? Gait assessment, well, hopefully you've learned, if you're relatively far through the program, that gait is the walking cycle or pattern. and specifically how someone walks on foot. And so a gait cycle is measured from the heel strike of one foot to the heel strike of the same foot again. So basically taking a step, right? And there's quite a few things that you're looking for in a heel strike, or excuse me, in a gait assessment, which is, stance symmetry, the figure eight movement of the hips, the swinging of the arms alternative to the leg that's moving forward, right? Things like that. But then again, also understand too what improper gait could indicate, pathological reason-wise. Palpation assessment is the next topic in this category, and could be a broad and encompassing topic here, but we can probably assume a multifaceted component to this topic, because it could be palpating and finding bony landmarks. It could be palpating and finding the different muscle layers. It could be palpating and finding the various types of tissues. And now there is, and I think it's a little crazy, but there is some literature on what certain tissue types should feel like. So that, like connective tissue in regards to either being like a tendon or a ligament or, fascia, right? What should that feel like? What should muscle fibers and muscle tissue feel like, right? Should be like stringy, striated. I think that like ligaments are likened to like feeling like a band of duct tape or something like that. Weird stuff, but you could probably find it and it might help you out. I probably wouldn't, go crazy trying to like, oh, what does this tissue feel like? Oh, it feels like a thing of sandpaper, Bob. Okay, cool. But might help, but at least having the general understanding of what palpation is, which is the assessment through touch, and how you can assess certain things through touch, and what would you be finding, right? And what would those findings again lead to, right? Like, oh, here's a nodule. Could that be a micro contraction in the muscle? Could that just be like a spasm? Could that be some sort of cyst? Could that be whatever, right? Things like that, Range of motion assessment. Okay, so it's listed there. Cool. So range of motion assessment is, I do try to teach the gist of this concept, which is called goniometry. Goniometry is the science of and the measuring of joints' range of motion. Now, it gets pretty detailed and it goes pretty in depth, but the easiest explanation is, first and foremost, when we ever reference a movement or anything in the body, both an anatomical structure or a movement or whatever, it's always referenced from anatomical position. So if anatomical position is always the initial starting point, then you pretty much just go off of there, right? So for instance, oh dang, he doesn't have an arm. All right, well, it's fine. So for instance, if I wanted to measure a movement, let's say at the shoulder joint, and let's just say lateral abduction, which means taking my arm out to the side. Well, lateral abduction, my arm neutral should be here in this position pointing straight down. And it's just essentially a game of geometry at that point. So you know well enough that, well, if this is my arm sitting and resting down at 0 degrees, my arm going out straight to the side is 90 degrees. So that means if I go from here, neutral, to here, that's 90 degrees. That is a 90-degree movement of the glenohumeral joint in regards to lateral abduction. And it's just how it works with any movement, right? Start from the neutral position. And then if I said I wanted 180 degrees of hip flexion, well, from neutral position, 180 degrees is my hip is literally right alongside my head. For me, that's impossible. Not for everybody, but yeah, for the most part, ain't many people going to be doing 180 degree of hip flexion. So, I mean, you can definitely look up goniometry and have a decent understanding of it. It's pretty simple, the basics understanding of it, but it does get pretty advanced. And again, justifying the means of, well, what it means is a relatively important thing. And then, of course, clinical reasoning, which is probably the broadest category you could ever have, which is kind of what I've been saying, throughout this whole video, which is being able to evaluate both the client's health history, your knowledge of massage, your knowledge of pathologies, your knowledge of contraindications, your knowledge of all these anatomical structures and this, that, and the other, and align that with the client's goal to make a treatment plan, to make a massage routine, to kick them out the door if they shouldn't be getting this massage, right? That's really what it all comes down to. And that's where this category, the clinical reasoning, and being able to abstractly pull all of this information that you've learned and gathered together is something that can't be taught. I know that's kind of depressing to hear, but I can give you examples. But there's so many ways to formulate a scenario. There's so many ways to formulate these particular instances and tell you what pieces of what information are relevant to this particular situation, that it's impossible to go over in every encounter and everything that you might see. So it really just takes you understanding what I call the core concepts, which is what massage does and why, how the body functions, what massage can do in regards to that, ruling out pathologies and contraindications, and then piecing it all together, right? Which, I mean, it goes further into explaining what clinical reasoning is, which is pretty much looks like everything I just mentioned there. So, pretty straightforward there. Ethics, boundaries, laws, and regulations. Probably the most simple, yet very large section of the MBLEX. How do you behave ethically as a massage therapist? Now, obviously, we can see that there's various breakdowns here. Excuse me. So I'll try to pick out just a few, and then I'll go over just a general concept of how to approach ethics. But laws is probably the most common one, because while yes, we want to understand the legalities of massage, the MBLEX in itself is obviously used in a bunch of states, and each state has their own different laws. So they're not going to go over specific laws of your state. It's going to be like general stuff of what's just most commonly unaccepted across the board in massage, which is never diagnosing or prescribing things or treating someone for certain things and stuff like that, right? So just the general what's out, which kind of just lines up with scope of practice, like what are we legally allowed to do kind of thing. But the easiest way to approach massage is this. Ethics massage. Be a little fluid, but at the same time rigid. I know that's kind of contradictory, but the easiest explanation I can give for that is that in regards to answering an ethical question for massage, there's the MBLEX answer, and then there's a real life answer. And a lot of times the real life answer is probably what we're going to want to choose and what we would normally do, but we should answer for the MBLEX. Here's an easy example of a question that I've encountered that students had, where it was like saying how a client comes in habitually late for their appointment and they only get like half the session or something, right? And it explains in the question that the client was informed by the front desk staff that, by coming in late, it reduces the length of their massage. And it even said that the client was like, that's cool, whatever, right? And the question asks, what's the appropriate, route for the massage therapist to take? Of course, you throw away some options and you're left with two choices. One is do nothing, provide the massage for the allotted amount of time, which is the real life answer. And that's definitely what I would do, because I don't care if you're cool with paying full price and I get paid full price for half a massage. By golly, oh Molly, I will do that every day. But the real MBLEX answer was reinstate to the client that by reducing the amount of time in the massage reduces the effectiveness that they will get from their massage. But I don't care about their effectiveness. I'm getting money. So that as people walking by, might scare them. So, try to be relatively rigid, robotic, but have a little free form to it just in case you need it is kind of my go-to. Because generally, ethically, the MBLEX wants us to be massage robots in a sense, right? Where it's like, I do massage, all I talk about is massage. I tell you nothing about me except for massage. And that's kind of how you should generically approach it. Our last category here, and hopefully this video hasn't taken 10 years to record. Last category here is guidelines for a professional practice. Again, kind of goes along with the ethics stuff. Very easy basics. Making sure that you understand how equipment works, how to sanitize equipment, how to maintain your equipment, maintain your facilities for safety, all that good stuff. Making sure you understand body mechanics is a big thing. Pretty much everything we taught you since you started this program, biomechanics, right? Your stances, what the stances for, what techniques can be used in the stances, stuff like that. Appropriate draping, consent for draping, things like that. Business practices is probably going to be the most complicated part of this section. And I hear a lot from a lot of my students that recently have taken the MBLEX that they found a lot of law questions on there. Relatively simple ones, but still like business-based questions like, what form do you fill out? What tax form do you fill out if you're a sole proprietor, if you're a W-2 or employee, if you're a general partnership, stuff like that. What are parts of a business plan? What is all these different licensings for? So, and unfortunately, I don't have a business degree, so I'd probably be in the same boat as you guys of not knowing some of that crap. But, a big thing I talk about in regards to being as prepared as you can for the MBLEX is just having the biggest, broadest base of knowledge that you can and being able to apply all the core concepts and knowledge that you have together, right? Because it's impossible for you to know and learn everything that you can and will see on the MBLEX. So my biggest job, and my biggest advice to you is to understand things you're most going to commonly see, right? For instance, in regards to muscles, if there's a tiny little muscle like this behind my eyeball and it comes up on the MBLEX, sure, whatever, right? I don't care, because that tiny muscle was probably going to take me a lot of time to learn. And I got one question wrong about it. Oh, well. But I had the trapezius muscle come up 4 other times. So technically, out of just those kinesiology questions, by only learning one major thing as opposed to learning smaller, insignificant stuff and putting more time to learning the major concepts in more detail, I still get a passing score, right? I got an 80% on that. And that's all that really matters, right? It's not about getting 100%. It's about passing, right? So, that's just a general breakdown of the categories here for the MBLEX. My general advice on how to look at and approach each one and potentially where you can find that material. Like I said, there's lots of videos that are already recorded, and we'll progressively record more videos for a lot of those topics, but you can always find those on your study sessions and helpful tips module section in your Canvas. So I'm going to end the recording there.